So here we're going to see some lab studies. First one, vital sign, heart rate, respiratory rate, blood pressure, and temperature. When a patient these four vital signs within the normal range, it indicates the patient is stable. If the vital sign is fluctuating, it indicates patient is unstable and we could notify to the healthcare provider. Heart rate normal 80 to 100 beat per minute. And some books said it is 60 to 100 beat per minute. If the heart rate less than 60 beat, we call bradycardia. If heart rate is more than 100 beat per minute, we call tachycardia, right? So respiratory rate here, basically it is 12 to 20 beat per minute. If we see the respiratory rate less than 20, patient develop the bradypnea. If it is more than 20, or some book wrote it is 22, it is trachypnea. And blood pressure normally systole is 110 to 120 systolic, and diastolic blood pressure is 60 millimeter of mercury, but average one it is 120 over 80. So systolic blood pressure should be 120, diastolic blood pressure should be 80. If you talk about the range, systole should be 100 to 140, and diastolic should be 60 to 90. So systole over diastole, if both one increase, we call hypertensive patient. If only systole is go up but diastole is normal, it is also hypertensive. If the systolic blood pressure is normal but diastolic blood pressure is upper than normal, it is hypertensive too, right? Body temperature. The normal body temperature is 37 degrees Celsius. If you convert the Celsius to Fahrenheit, it would be 98.6 degree Fahrenheit. Now, let me talk about some hematological values. Hematology means blood values. First one is a red blood cell, shortly called RBC. The red blood cell, they carry the oxygen from the lungs to the tissue around your body. Same time, red blood cell carry out the carbon dioxide from tissue to lungs, and lungs can expel out carbon dioxide from body to environment. The red blood cell also can carry the nutrient. The normal red blood cell is 4.5 to 5.0 million. In case some book mentioning in case of men, it is 4.5 to 6.2 million. And in case of female, it is 4.5 to 5.0. The female red blood cell is less because of their body structure and blood loss, like because of menstruation. And if the red blood cell go down, hemoglobin go down as well, and patient develop anemia. Now go for hemoglobin first. Hemoglobin, the normal hemoglobin range in case of female, 12 to 16 gram per dl. In case of men, 14 to 18 gram per dl. Hemoglobin also transport the oxygen to the tissue and carbon dioxide back to the lungs from tissue. The red blood cells are made up of hemoglobin. If this is low, always we should think iron deficiency anemia. Now let me talk about the hematocrit. Hematocrit is the ratio of volume of pegged red blood cell to the total blood volume. If the hematocrit is low, it does mean decrease in oxygen capacity over hydration. If hematocrit is high, in some medical condition like burn, diarrhea, or polycythemia vera, hematocrit level go up. Burning patient, diarrhea patient, and polycythemia vera patient. Hematocrit normal range in case of female 37 to 47. Some book wrote it is 36 to 46. In case of men, it is 41 to 51%. Some books said 40 to 54. If anybody's hemoglobin go down, hematocrit also should go down. Next here, white blood cell or WBC. Other name is called leukocyte. Leuko means white. WBC is the body defense against infectious organism and foreign substance. So if any infection catch up, WBC come first to fight, particularly neutrophil come first. Like if any patient have to take the chemotherapy, and chemotherapy would make this low. So chemotherapeutic patient is immunocompromised because WBC go down and they easily catch up by the WBC, so by the infection. So normal range of WBC is 5,000 to 10,000. Some book mention, they said it is 4,000 to 11,000 per cubic millimeter of blood. Next, platelet or platelet. The platelet is the smallest of all three major type of blood cell. All three. One is red blood cell, second is white blood cell, and third one is platelet. It is the smallest. So particularly in our body, the bone marrow can produce red blood cell, can produce white blood cell, and can produce the platelet. Bone marrow can produce. Particularly platelet, the function is to prevent the bleeding, right? So the normal cell is 200,000 to 400,000 microliter. So sometimes NCLEX board asks a question, what are the common medication will quickly disrupt the platelet function? Answer is aspirin. Aspirin is a medication can quickly disrupt the platelet function and patient present with bleeding. Now let me talk about some electrolyte like sodium, then potassium, calcium, chloride, magnesium, and phosphorus. Sodium, the normal range is 135 to 145 milliequivalent per liter. Sodium maintains the body fluid level, and sodium is very important our muscle and nerve function, right? So if anybody sodium level is less than 135, we call hyponatremia. If it is more than 145, we call hypernatremia. If sodium imbalance occur, they lead to potassium imbalance. And potassium imbalance can lead to cardiac arrest, dysarrhythmias, if you untreated. And potassium normal range is 3.5 to 5.5 milliequivalent per liter. Some book mention it is 3.5 to 5.1 milliequivalent. Both is correct. Potassium is an important mineral and electrolyte in the body. Basically, potassium carries an electrical charge, and it is important for heart function and is important for every cell. Next one is a calcium. Calcium is a mineral important for our bones and teeth development, dental development. The normal range of calcium is 8.5 to 10.9, or some book wrote 10 milliequivalent per liter, right? If the calcium level go down or less than 8.5, patient develop hypocalcemia. If calcium level is more than 10, patient develop hypercalcemia. Basically, parathyroid gland regulate our calcium and phosphorus level. The potassium, if less than 3.5, we call hypokalemia. If more than 5.5, we call hyperkalemia. Next one is a chloride. The salt we ate or we use during the cooking, this is sodium chloride. We are talking about the chloride. Normal range is 95 to 105 milliequivalent per liter. Chloride is an electrolyte and keep the fluid balance. So when electrolyte imbalance occur, it is important input and output of the cell need to check. We get most of the chloride from the sodium chloride that we ate, and it is digestive in the intestine. Now let me talk about the magnesium. Magnesium normal range is 1.5 to 2.5 milliequivalent per liter. Some books say it is 1.6 to 2.6. Again, I said both is okay. Magnesium is important for our nervous system, and they help the muscle, and muscle helps to neutralize, or magnesium helps to neutralize the acid in the stomach. There are some medication contain the magnesium. So if NCLEX board asks, what are the medication that contain magnesium? Answer is milk of magnesium or milk of magnesia. And next one is here, phosphorus. Phosphorus is 2.5 normal range to 4.5 milliequivalent per liter. If calcium level go up, usually phosphorus level go down. If calcium level go down, phosphorus level is supposed to go up. Example, hyperparathyroidism. In hyperparathyroidism, excess parathormone release more calcium in blood, but phosphorus go down. In case of hypoparathyroidism, where parathormone go down, calcium level go down, but phosphorus level supposed to go up. It is opposite. Next here, some blood chemistry. Let me explain. First one here, blood glucose level. The blood glucose normal 70 to 110 milligram per dl, right? But if we see anybody's blood sugar level more than 110, we can tell it is hyperglycemic. But before to say patient is diabetic, it is good to check hemoglobin A1C. It is the confirmatory test. So serum glucose is the amount of sugar in the blood, and most of our sugar comes from carbohydrate, and glucose usually metabolized by insulin. Next one is a specific gravity, urine specific gravity. Usually it is 1.010, 1.030. So urine specific gravity, this is done to test the kidney function. So when we see the urine specific gravity not within the normal range, it indicates there's something wrong with the kidney, maybe. So we need to check the kidney function test like serum creatinine or BUN level. Urine specific gravity, this test looks at all of the particles in urine. Usually, in case of diabetes insipidus, the urine specific gravity go down, but diabetes mellitus urine specific gravity is supposed to go up. Next one is a BUN, means blood urea nitrogen. Blood urea nitrogen is an indicator of kidney function or liver function. Usually it is 7 to 22, and some book wrote it is 8 to 25 milligram per dl, right? So BUN, this test measure the level of urea in the blood. Urea is a waste product that comes from protein. So the protein we eat after the metabolism, the waste product is urea, BUN. Keep in mind, it's what is the leftover. What are the after the protein digestion, what is left over, that is the urea. Urea basically is made in the liver, but then it is the kidney's function to get rid of it through the urine. Next is creatinine, serum creatinine. Usually it is 0.6 or 0.6 to 1.35 milligram per dl, 1.3 or 1.35. So if the serum creatinine concentration is high, it indicates the renal dysfunction or renal failure. So kidney function test or kidney test from the muscle that has been metabolized to the waste product. It is the creatinine. And next one here is called LDL, lactate dehydrogenase. Normal range is 100 to 190 unit per liter. Now let me talk about the protein. The normal protein range is 6.2 to 8.1. And when you break down the protein, we get amino acid. We have a 20 essential amino acid our body needs. When you break down the protein, we get albumin. Albumin is the smallest molecule of protein. Albumin normal range is 3.4 to 5.0. If the protein is go down or albumin go down, it means our liver does not synthesis. And when protein is passing through the urine, our oncotic pressure go down and patient develop edema. Next is bilirubin. Bilirubin is a formation in biliary system. Bilirubin formation inside the liver. If the liver problem or biliary obstruction, biliary cirrhosis, the bilirubin level go more than normal range and patient develop jaundice. It indicates patient has a liver problem or biliary system obstruction. Usually bilirubin supposed to less than 1.0 milligram per dl. What next? Total cholesterol, right? The total cholesterol is normally supposed to be less than 200. It is normal. 130 to 200. But easy way to remember, total cholesterol supposed to be less than 200 milligram per day in our body. It indicates your heart is healthy. Now triglyceride, shortly called TG, it's supposed to be 40 to 50 milligram per dl. If anybody has a atherosclerotic heart disease, or if anybody has arteriosclerosis, or if anybody has a hyperlipidemia, high cholesterol, their cholesterol level supposed to be more than 200, triglyceride level supposed to more than the normal upper limit. So they need to change the lifestyle, healthy food, or cholesterol lowering medication like statin, simvastatin. Uric acid normally 3.5 to 7.5 gram per dl. And last one here, CPK, C reactive protein kinase. Normal range is 21 to 232 unit per liter. So if anybody has a chronic inflammation in the body, if anybody has a chronic infection in the body, their C-reactive protein always be go up. It indicates they have an active inflammation in the body. So it is essential to find out what are the underlying cause of inflammation. It indicates CPK increase, means patient has an active inflammation.